businesses, there are still people making plans to go out. And although everyone wants to support struggling pubs, cafes and restaurants, is it right that we should still be heading out like we did before? In the war, there were posters and campaigns like, "Is your journey really necessary?" You will have seen them, mainly, in museums. These shamed people into not wasting resources. There was rationing too, and it relied on everybody doing their bit, as this clip from Pathé hints.
A word before rationing begins. The best way you can help is by rationing yourselves. I'm sure that all of you will buy your fair share and no more.
Now, you may think, why are you invoking the war here? But there is a lot of time and talk being dedicated to a wartime sense of responsibility. To quote the Prime Minister yesterday, he finally used that phrase. He talked of being on a wartime footing. He also talked of the measures being announced, never been seen before in peacetime. So is it also time to reintroduce, and I hate to say it, it sounds incredibly harsh, but it might be necessary for some, a sense of shame for those people who don't follow the rules? Only last night, my husband going out to try and get some fresh food from the supermarket, walked past the restaurant we live near. It was full. The supermarket was empty. A full restaurant? I mean, he's not going to walk in there and say, shame on you, is he? But what are those people doing when we've been told, yes, they've not been shut down, the restaurants, but we have been told to avoid gathering in a place together and going out in groups. We've been told to stay in our units. Should we be embarrassing each other into staying in? Have you had some of these conversations? Have you had to shame someone into cancelling something? Or are you cross that they won't alter their plans? We also have to be honest with each other. If you're going to see someone and they know that perhaps they've been in contact with someone who perhaps has been in contact with someone who's had some sort of symptoms, you have to tell each other, don't you? Are you right now waiting for someone to see sense and accept that their event will have to be called off? Or are you not waiting? Have you called them out about it? 08085 909 693. You can text on 85058, tweet at BBC5Live or email emmabarnettshow@bbc.co.uk. James says, can you tell your listeners that if they don't take this seriously, then we could have, or he says we will have, and I'll say could, 10% death rates like Italy. Italians were advised and the majority of the Italian public didn't take the advice. It is incredibly serious, and you'll hear that with my first interview today. But in terms of that question about shame and about trying to get others to follow the advice if they are not doing so, and crucially take this seriously, what are you doing in your life? How is this playing out? Have you got something that's still in the diary that you organised and you haven't cancelled it yet? And I'm talking about this week or next week. I'm not talking maybe about 6 months' time, but of course we could be in a different place then. The point is we just don't know. 85058. Yesterday the Prime Minister for the first time talked of us being on a wartime footing. That means all of us playing a part, and in this instance, in this particular circumstance, taking a whole other approach to our daily lives. 08085 909 693. But first this morning, a remarkable interview from the hospital Frontline. Dr Nishant Joshi is an A&E doctor at Luton and Dunstable General Hospital. I spoke to him before we came on air when he just finished a long night shift. It was a sobering interview, a very sobering conversation indeed, and we had to share this with you. As a doctor, he doesn't feel protected. He doesn't feel he's protecting his patients. He says there's not enough facial masks and proper protective gear, not enough testing, confused messages, and you, the public, not taking it seriously enough. Have a listen.
Right now there's a mood of the hospital feels eerie. It feels like the tide has gone out and everybody's just standing and watching and waiting about what's going to happen next. And anybody who's watched any disaster movie knows that there's a massive tidal wave, a tsunami about to hit us, and we're all just waiting for it.
And as those on the front line, do you feel equipped?
That is the main concern of doctors, and it is the main concern of doctors all across the country. It's been raised by Jeremy Hunt to to the select committee yesterday, and we don't feel that even that the answer given was adequate at all, because all the answers to all of the questions that people have been asking was, we're escalating things, we're trying our best, we're planning. And the whole point is, for disaster planning, you plan years in advance. You don't plan for a pandemic on the spot. You don't make it up as you go along. You plan it years in advance. And the thing is, UK had the best position out of all countries to be affected, because we're one of the last countries to be affected by this. And we had the warning that Italy gave us, saying it's not just an Eastern disease, it's not a Chinese disease. People need to understand that this is something which has been coming for us, and it's been coming up for us in a very ominous way. And we're really, really concerned that the government aren't taking us seriously. PPE is personal protective equipment. We're seeing patients in A&E, and this isn't just myself in my own hospital, it's across the board. The PPE guidelines have been changing on a daily basis and sometimes on an hourly basis. We are currently wearing flimsy aprons, and I would cast people's minds back to if you were at school and you would be wearing bibs and vests when you'd be playing football. I think those vests would be more suitable protection than what we're wearing now. For some patients, we're wearing surgical masks. For some patients, we're not. It's chaos all over the country. If a patient coughs on me, I'm then a potential vector of transmission. This should be a number one concern.
Before we just come to testing then, are you saying that those on the front line, your fellow doctors, nurses, you aren't being equipped with the adequate clothing and facial protection to do your job?
Local guidelines and national guidelines are telling us that it's okay to wear an apron, and it's okay to wear a surgical mask, which is a flimsy piece of paper, and that's for patients who are suspected of having this highly infectious coronavirus. Patients who are being seen in A&E who might come in with problems, for example, an ankle fracture, seemingly non-viral related, may still be highly infectious vectors of transmission. These patients may cough on me, as happened overnight. I had a patient sneeze on me and cough on me, which happens on a daily basis during non-pandemic times. But this patient came in for non-viral related symptoms, and he didn't have a mask on. I didn't have a mask on. I went to take his blood, and poor fellow, it's not his fault that he started to feel a bit under the weather, but he sneezed on me, he coughed on me. Where does that leave me? We are concerned about being vectors of transmission. We are concerned that we are the super spreaders. We are concerned that healthcare workers are spreading the infection. And the reason we're concerned is because all of the data from China, from Italy, from Iran, from other countries that are being affected by coronavirus, this awful pandemic, is that healthcare workers can be vectors of transmission. And the average, I think the sort of contagious ratio, if you like, the number of patients or the number of people who can then be infected by a single person is about 2.4, I understand, for coronavirus. So the average infected person then goes on to infect another 2.4 people. For healthcare workers, dealing with people and going in between departments, going between pediatric departments, going to see psychiatric patients who then go to psychiatric wards, then going to see patients who may be suspected of having heart attacks, to then going to see patients who then suspected of having coronavirus. You can see how we're really concerned how this could spread. And it's not just between doctors and nurses, healthcare assistants. It's about porters, it's about domestic staff, everybody who enters the hospital. And our question is, why is our strategy so different to other countries who've handled it successfully? We've had time. We've had the ability to watch other Titanics hit the iceberg and say, oh, I wouldn't do that if I were you. I mean, how silly were they? How silly were they? They saw it coming, we saw it coming, and now we're in that position where, as doctors and nurses, we feel that we've seen the iceberg from miles and miles away. We've had the option to say, okay, well, look, maybe we won't get away with it completely, but maybe if we just suffer a glancing blow, that might be okay. And really, it feels like right now we're rearranging the deck chairs on the Titanic, And for us, it feels like the doctors and the nurses and the healthcare assistants and the porters and the domestic staff, everybody works in hospital. It feels like we're the band playing on the Titanic.
What do you want to be done differently right now?
We need PPE. We need equipment to guarantee that we're not vectors of transmission.
So, when you go in on your next night shift, you want waiting for you there what?
We want something which gives us adequate protection against patients who might have coronavirus. The government guidelines keep on changing on a daily basis, but essentially the accident and emergency main bay and hospital bays as well across the country are open for business to coronavirus. That's how I would put it. They're inviting infection by not having masks on patients. And this is the question we have to put to our politicians. Why is it that across the country, staff are being told there aren't enough masks? This is the sort of thing that we hear in third world countries during epidemics. And we look on the TV, we tune into BBC, we tune into the news, and we feel a sense of sorrow and pity for other countries. And now it's hitting us, supposedly an advanced country with an advanced healthcare system, with politicians in fancy suits who tell us that we've got £300 billion to inject into the economy. That's great. Why can't I wear a mask to keep myself safe and the patient safe? And then when I come home, my family's safe as well.
What is your family situation?
I live with my wife, and she's pregnant, and she's also a doctor. She also works in an emergency setting. The guidelines for this are all higgledy-piggledy, all over the place. We are essentially isolating ourselves in different sections of our house. And so it's quite difficult, really. And it puts into question other questions that we're going to face over the next months, really, because we're not testing people. There's a good chance that one of us may have already had coronavirus. So what happens if a week before the birth of my daughter, what happens if I develop a cough or a tickle in my throat? I haven't been tested, so I don't know if I've already had coronavirus or I have it right now. I'm then faced with a potential situation where if I have a tickle in my throat, do I then isolate from my wife? Do I isolate from my newborn baby? What happens then? There is so much up in the air about this. It is just, it defies belief that we're this unprepared, having been given so much time.
And yes, at the same time, we're seeing, as you say, the chief medical advisor, the chief scientific officer saying very calmly, we're following the science, we're following the evidence. But you've just painted, quite frankly, a horrific picture of what it's like being on the front line of the NHS right now.
Well, I think the deal is that before a pandemic, you can only really overreact. You only figure out if you've underreacted too late. And right now, I don't think there's a sense of urgency from our politicians. I think that there are contradictions amongst the messages. The communication has been really poor, so that the public don't really grasp the severity of it yet.
Do you think the public are taking it seriously enough? Because, various messages I saw online last night from people I follow on social media. One said, the supermarket aisles this evening are completely empty in Sainsbury's, but my local pub is packed.
Yeah, I've seen similar. Some places which are hotbeds for social gatherings are completely full. I do think it seems to vary on this regional basis. Some shopping malls seem to be empty, some seem to be very, very busy.
But what would you say to the public as someone who wants to keep them safe, as someone whose job it is to keep them safe? What would you say in terms of taking this seriously?
I can only offer my own family situation, which is that I've asked my father and my mother to isolate themselves. I've asked my grandfather to isolate himself. Any social gatherings are completely out of the question. Any baby shower is completely out of the question for us. It's really upsetting and distressing to see that pubs are still open, but I I would add that it doesn't seem to be any fault of any publican, and it doesn't seem to be the fault of the public for attending. They have not been given the sense of urgency from our politicians to say. I mean, they essentially said, avoid the pubs. That was the language. Avoid pubs and clubs and social gatherings. They're not said don't. I mean, if Boris Johnson tells you to avoid go to hang out with your friends, I mean, you'll say, okay, Boris, I'll think about it, and then you go for a pint.
Just to come back to the healthcare situation and what it's like in hospitals right now, and I'm very aware that you've been up all night, so I do want to let you go and get some sleep. I know that it's not in the DNA of doctors to think of themselves. That's not why you're in your job. But you did say to our team that it was inevitable that some healthcare professionals would die from this. What are you thinking as a group of people at the moment about that and about each other trying to deal with this?
Even healthcare professionals are kind of in denial about what the reality of this is, because none of us has faced anything like this in our lifetimes, apart from those of my colleagues who've worked for Doctors Without Borders and worked abroad in war zones. These are the only people who really truly understand and grasp the severity of it. If we look at statistics, for example, from China, we know that at least 50 healthcare professionals have died, and over 1,000 people were 1,000 healthcare professionals were hospitalised. And people who know doctors and nurses will know that we will be the very last people to admit ourselves to hospital. In Italy, the statistics show that at least between 8 and 12% of all hospitalised patients are doctors and nurses. If 10% of the hospitalised population are doctors and nurses, what sort of hole does that leave for the NHS in the next few months if this is to be the case? And what effect will that have on morale over the next few months, the next few years? It's just, everything just seems to be a real shambles. But I think just to loop back to our earlier point about Boris Johnson and his chief medical advisors, I think our key gripe, and this is with all healthcare workers who I've spoken to, the head of the WHO said on Sunday, test, test, test. He said it's not possible to fight a fire blindfolded. And I think that was a pointed response to England's tactics currently. And that's the one thing that we need an answer to. We need an answer. Why aren't we testing? Why are we going against WHO? Why are we going against other countries in this? If we have a brilliant strategy thought out by Number 10 that ends up working out, then we'll be the first to give them credit. But why are we being so contrarian to the extent where we're actively ignoring this? And why are we not being given PPE? WHO has said it's not possible to fight a fire blindfolded. Right now, we're fighting a fire blindfolded, fighting an invisible enemy blindfolded, with both hands tied behind our backs, and healthcare workers are at grave risk, and people need to know about it.
Do you think there's time to get it back? I mean, the NHS is also the envy of the world in many respects, and it's a jewel in the crown of the UK. Do you think that if things change, as you say things are, we all see this hourly, daily, that we can get it back if you get the protective equipment, and also if we ramp up our testing?
We can only lessen harm right now. It may be later than ideal, but as far as I'm aware with this pandemic, obviously it's a highly fluid situation, but I would hope that we're not past the point of no return. So we just have to do it. Just give us answers. Why do we have 300 billion in the bank for economy, but we don't have enough masks in the hospitals?
Thank you for coming to talk to us. Some really pertinent questions. Of course, we'll see if we can get some answers, and there'll be another conference today. Perhaps there will be more answers forthcoming. I hope you managed to get some sleep. Are you back on in the next shift, in the next 24 hours?
Back on tonight, 10 p.m, 10-hour shift. Can't wait.
Good luck with it. And
Thanks very much.
Thank you very much for all you're doing.
Thank you so much.
Dr Nishant Joshi there, a very sobering but important insight we wanted to bring to you about life on the front line in our hospitals. Boris Johnson has spoken about being on a war footing. Well, arguably, nowhere is more of the front line right now than with our medics, whether that's in hospital, whether that's those visiting care homes, whether that's in our GP surgeries, but right on the front line are those in A&E as always, and that is what life is like for someone coming straight off a night shift. A lot of questions for authority, many of you getting in touch with your questions for authority, not necessarily on the medical front, but when we asked you right at the beginning of this programme about what do we do about those who will not cancel arrangements, who are still going to